Hello guys, this is Indian Medico and in this video we are going to see about Hypopyon corneal ulcer. This is a concise presentation for medical students. Hypopyon is a medical condition involving inflammatory cells in the anterior chamber of the eye. That is, in Hypopyon there is leukocytic exudate in the anterior chamber of the eye. The term Hypopyon corneal ulcer is reserved for the characteristic ulcer caused by pneumococcus. Hypopyon corneal ulcer is also known as ulcer serpens. The term corneal ulcer with hypopyon is used when it is caused by other organisms like Staphylococci, Streptococci, Gonococci, Moraxella and Pseudomonas pyocyanae. Now let us see about the etiopathogenesis of Hypopyon corneal ulcer. The most common source of infection for Hypopyon corneal ulcer is chronic dacryocystitis cystitis. The predisposing factors include virulence of the organism and resistance of the tissue. Now let us see about the mechanism of development of Hypopyon corneal ulcer. The corneal ulcer can cause iritis due to diffusion of bacterial toxin. This can lead to outpouring of leukocytes from the vessels. These leukocytes gravitate to bottom of anterior chamber, leading to the formation of hypopyon. The hypopyon is sterile because outpouring of cells is due to toxins and not due to actual invasion by bacteria. The hypopyon is absorbed once the ulcerative process is controlled. Now let us see about the symptoms of Hypopyon corneal ulcer. There will be pain, foreign body sensation, watering, photophobia, blurred vision and redness of eyes. The pain will be very little during initial stages of Hypopyon corneal ulcer. Now let us see about the signs of Hypopyon corneal ulcer. There will be swelling of lids, blepharospasm, chemosis, conjunctival hyperemia and ciliary congestion. Ulcer serpens is a greyish white or yellowish disc-shaped ulcer occurring near the center of cornea. It is called as ulcer serpens because it resembles a snake. The ulcer has a tendency to creep over the cornea in a snake-like fashion. There can be violent iridocyclitis, there can be secondary glaucoma due to hypopyon, and Hypopyon corneal ulcer spreads rapidly, leading to early perforation. This picture shows Hypopyon corneal ulcer. Note the hypopyon and the corneal ulcer. Now let us see about the clinical evaluation of a patient with corneal ulcer. Thorough history taking should be done. General physical examination should be done. Ocular examination should include diffuse light examination, regurgitation test and syringing to rule out lacrimal sac infection. Biomicroscopic examination should be done with fluorescent dye. The eye should be observed under blue filter after staining with fluorescent dye. The ulcer appears green in this case. Now let us see about the laboratory investigations done for a patient with corneal ulcer. Routine laboratory examinations like hemoglobin, total leukocyte count, differential leukocyte count, ESR, blood sugar, complete urine and stool examination should be done. Microbiological examination should be done. That is, corneal scraping should be taken under local anesthesia. The scraping should be taken from base and margins of ulcer using modified Kimura spatula. The corneal scraping should be subjected to gram stain, Chimsa stain, 10% KOH wet preparation and calcofluor white stain. These are done to find out the causative organism. The corneal scraping can also be cultured on blood agar or subarachnoid dextrose agar. This is also done to find out the causative organism. Now let us see about the non-specific treatment of a case of corneal ulcer. Cycloplegic drugs like 1% atropine can be given. Systemic analgesics and anti-inflammatory drugs can be given. Vitamins like A, B complex and C can be given for early healing of ulcer. Hard fermentation and dark goggles can also be given to the patient. Now let us see about the specific treatment of a case of bacterial corneal ulcer. This is the treatment given in Hypopyon corneal ulcer also. Topical antibiotics like fortified cefazolin and fortified tobramycin should be given. Both these drugs are started empirically and are instilled alternately. They are instilled every 5 minutes for 30 minutes. Then they are instilled for every 15 minutes for 2 hours. After that, 1 hourly round the clock for the first 48 hours. Then decrease the dosage to 2 hourly during the day and 4 hourly at night till healing is ensured. Then decrease the dosage to 4 to 6 hourly till healing occurs. Fortified vancomycin and ciprofloxacin drops can be used as alternatives to these two drugs. Systemic antibiotics like ciprofloxacin can be given in fulminant cases with perforation. Now let us see about the treatment of non-healing corneal ulcer. If a corneal ulcer is non-healing, then the following measures should be taken. Removal of any known cause of non-healing ulcer like raised intraocular pressure, diabetes mellitus, etc. Mechanical debridement of ulcer can be done. Cauterization of ulcer can be done. Bandage soft contact lens can be given to the patient. Peritomy, that is severing of perilimbal conjunctival vessels, can be done. Now let us see about the prevention of perforation in a case of corneal ulcer. The following steps should be taken to prevent perforation in a case of corneal ulcer. Avoid staining like coughing. Pressure bandage can be given to the patient. Decrease the intraocular pressure using acetazolamide, timolol, etc. Tissue adhesive glue like cyanoacrylate can be given to the patient. Bandages of soft contact lens can be given to the patient. Conjunctival flap can be done. Amniotic membrane transplantation and penetrating therapeutic keratoplasty can be done to prevent perforation. Now let us see about the treatment of perforated corneal ulcer. Tissue adhesive glues can be used. Covering with conjunctival flaps can be done. Bandage soft contact lens can be used. And therapeutic keratoplasty can be done for a case of perforated corneal ulcer. Now some special points regarding hypopyon corneal ulcer are: secondary glaucoma should be anticipated and it can be prevented by using timolol eye drops and oral acetazolamide. Chronic dacryocystitis, if identified, should be treated by dacryocystectomy. If you have any suggestions, please let me know in the comment section. If you like this video, please like, share, subscribe and tell your friends about this channel. Thank you.